Hi moms, let's talk about eczema, a common skin condition that makes the skin dry, itchy and inflamed. Now this is usually caused by a combination or linked to a combination of genetics. If your family has history of allergies, asthma and eczema, then your baby could actually suffer it. It could also be linked to allergens or triggers like allergens, pollen, dust, grass, paints. All these could actually trigger an eczema reaction. It can also be linked to the skin barrier having issues. They are proteins basically meant to keep your baby's skin or whoever person that is suffering from eczema's skin intact, so that it can be able to contain moisture. But with a person with eczema, some of these components are not there or they are weak, and then as a weak skin or a weak barrier of the epidermis, which is the top layer of the skin, this allows pathogens to get into the baby or the person that is suffering from eczema, and this will actually cause a lot of discomfort as the body tries to fight the pathogens. Then it causes inflammation. Then from inflammation, the person becomes itchy. They try to scratch, and during the process of scratching, they either break their skin, and that is how they end up with either the reddened spots or scaly spots of especially the head or the scalp, the face, the arms and the legs, and sometimes the chest and the neck. This is because those are also areas of heat, and one other trigger of eczema is heat. So now, basically, eczema would start in children around 2 months in infancy, 2 months to 6 months, but it can also start later on in life. So you could have not suffered from eczema while as a baby, but then later on in life, you pick up or it picks you up along the way in your life later on. Now, some of the symptoms, just like I said, is dryness of the skin, scaly patches on the face, on the scalp, on the arms, and on the legs. There is redness or swelling, especially where the baby scratches themselves. That is why you usually have that. There's itchiness that causes irritability, and the baby cannot be able to sleep for a long time. And then when it gets worse or when it gets infected, eczema starts to ooze, or the skin starts to ooze a yellowish discharge that is usually sticky, and sometimes it also gets crusty because of that discharge that is sticky. So when it dries up, it just gets crusty, and that is when we usually say it has gotten infected. How do you care for a baby that has eczema? One, frequently moisturize the baby's skin, and as you try to moisturize or use emollients or ointments or creams that are fragrant free, hypoallergenic, and use them generously several times in a day, because you are trying to keep moisture that this baby's skin cannot be able to contain. So you're trying to help this baby to maintain the moisture, unlike the other babies that do not have the eczema problem. Try as much as possible to bathe this baby and in lukewarm water or cold water. Lukewarm water or cold water is best for babies with eczema, because we said heat is one of the triggers that triggers eczema in itchiness in eczema-prone babies. So you want to make their bath lukewarm. You want it to be short. Let it be as short as less than 5 minutes. Let the bath of an eczema baby don't go beyond 10 minutes if you're to bathe your baby. Keep their bath short. Let it be limited to 5 minutes to 10 minutes. You do not want all the moisture that was in their body to just escape after their bath. So try as much as possible to keep them out of the water after the 10 minutes or the 5 minutes. When you are drying the babies with eczema, you do not rigorously rub their bodies like you would to any other normal baby. You would want to try as much as possible to tap up the skin. You don't do the rubbing, because when you do the rubbing, it triggers the itchiness, and that's when the baby will start scratching. If you've noticed that your baby is itching or is scratching every time they have a bath, then try and scale down on their bath time. If you are taking a bath, if the baby is taking a bath with soap, try as much as possible to make sure that it is mild soap. Don't go for soaps that have detergents in them. Most of us love bubble baths with this era. Please try as much as possible to avoid them. Normal bar soap is just enough for your baby to shower, and you can use your hands. You don't have to use harsh bath cloths on your baby. So try as much as possible to either use your hands, or if you must use a sponge, let it be very gentle and smooth on the baby's skin. After patting them dry, then you go in with ointment and keep them moisturized. You seal it in. Now try as much as possible to trim the baby's nails. If you are a parent that is usually busy and you don't really check out on your baby's nails, then and you have an eczema baby, then you want to try as much as possible to look out after 2 to 4 days. Try and check your baby's nails, have them trimmed short, because every time they itch and they want to scratch, they are not like grown-ups. They don't know how to scratch gently. So you go in and just grab whatever they grab, and it will leave them with a broken skin, which would now predispose them to infection. So you don't want that to happen. Keep them their nails short, and also keep them in mittens if they can't be able to be maintained with the scratches. Keep them in mittens so that they cannot be able to scratch themselves. When you are dressing a baby with eczema, try as much as possible to have this baby dress lightly. And if you can be able to afford the eczema-friendly clothes, I know they are out there in the market, please go ahead. But if you can't, stick to cotton. Cotton dressing is very good because cotton is gentle for the babies. So you try as much as possible to avoid over-bundling them. Do not overdress them. Let them have a lighter clothing. If you've given them a romper, let it be a romper. You don't need a onesie inside, a short-sleeved onesie, a long-sleeved onesie, and then a romper, then, I don't know, a swaddle. Please keep it very, very minimal on babies with it, because again, heat will trigger them to get into an eczema session of itchiness, and sweat is one of the other things that would also increase how they feel, how irritable they feel when they are in this state. So avoid all these, avoid the triggers. We talked about the triggers being heat, sweat, certain fabrics like wool. All those ones you would want to avoid them. Avoid having pets around if your baby is suffering from eczema and you've noticed that it is. Harsh detergents, if you're a person of Star Soft or I don't know, fabric softener, do not use any of those if you have an eczema baby. And actually, your babies don't need a fabric softener in their lives as they grow until they are maybe above 1 year. Then you can be able to use any of those softeners. So try as much as possible. Even when you're hanging babies' clothes, do not put them into contact with the grass, because you don't know what they will pick out from there. Maybe it could be dust, maybe it could be pollen. Try as much as possible to hang them in the sun, and from there you can iron them and have them ready for them to wear. Now, be consistent when it comes to moisturizing your baby. I'm saying this 100 times because it is very essential for the babies. It keeps their moisture locked in. If the baby is not responding to any of these, then you can go in and try and find out from your doctors or your pediatricians what kind of ointments would be good for them, what kind of emollients would be good for them. And they could recommend antihistamine creams, they could recommend steroid creams. Steroid creams would help in the inflammation, antihistamine with the itching, and also prescription creams to help strengthen the skin barrier. So watch out for your baby's skin signs and see if there are any signs of infection. We said if the baby's skin is removing or is oozing or getting a discharge that is yellow in color and it is quite sticky, try as much as possible to immediately take the baby to the hospital so that they can be assessed. Maybe an antibiotic will be given to them, and then they will be able to be prevented from a bacterial infection. Babies with eczema can be cared for, and eczema is manageable with the right treatment and care. Remember to be calm in all this as a mother. I know it is very hard to be calm, but remember to be calm, because if you're calm and informed, then it informs your way of making a difference in your baby's comfortability or getting them the right comfort that they need. Your takeaway is eczema is, one, manageable. However much it is a chronic one, it will be on and off. Try as much as possible to wait and be patient with your baby. Some babies will actually outgrow it as they grow on. By the 5th year, they'll be able to outgrow it. And if it comes later on in life, then you know how to care for them, be patient with them, and help them out. Keep them clean at all times, keep them moisturized at all times, and help them to be able to eat the right diet. Of course, I know there are some babies that usually get allergic reactions to foods. A baby with eczema, you need to watch out on their diet and see if there are some of the things that could be triggering the itchiness, and also cut that out or slowly introduce it later on when they have grown. Be safe and keep your baby safe.